Hi, my name is Jim Ahern. I'm a family doctor here in Ridgefield. And I wanted to tell you about some of my observations of the COVID-19 pandemic of 2020. We're recording this on 7/29/20. Came to Ridgefield in 1982 to be in a small group practice. And the next year started my own practice, which has now grown to 4 family doctors. So I've been in town for 38 years. And that all of my observations are based on the fact that I have patients who've been my patients for that long. So when you're a family doctor in one spot for a long time, you develop relationships that last over a long period of time, and so that's very, very rewarding. So this starts in pretty much in March. In January of this year, there were some reports out of China about a very serious virus, and then it came to California and Seattle area. But around March, it came to our area, and Connecticut was hit very hard, especially Fairfield County. Initially, there was a lot of confusion. I would say new information was happening every day. So we were seeing patients here, we were talking with specialists, we were reading everything we could read. Danbury Hospital did a remarkable job of getting through the pandemic in every way. I'll talk about that more a bit later. But they were doing regular audio conferences with all the doctors in the area and giving us all the up-to-date information. As things got worse, it was clear it was time to close our practice for seeing patients directly. And we began to do video conferencing, which we had never done before. At that point, a lot of my staff were frankly anxious about coming into the office, and we didn't really understand how, what all the symptoms of coronavirus would be. We didn't know how really to protect ourselves properly, and the numbers in our area were going up very quickly. So people were very understandably concerned, and we decided that we would stop seeing patients in the office. And we did that for 2 months. In terms of how staffing worked here in the office, we needed a skeleton crew to do the video conferencing, and there was a group of people who were comfortable being here, and we weren't seeing patients then, and other people were very happy to be at home and were really feeling anxious about being even in a small group of people in the office. And so they sort of voluntarily withdrew from work for a number of weeks. What was COVID-19 like? We learned a lot about it over time. Remember that no one had had any experience with this virus really prior to about January. And so everyone was learning quickly and learning on the fly. Initially, the symptoms were thought to be significant fever, shortness of breath, and a dry cough. So we started with that first. Initially, we had no testing available for the first few weeks. And so we were trying to work by symptoms. What happened was that about every week, a new symptom was added. So it turned out that, yes, although those 3 were still very important, that lots of people got headache and body ache and nausea and severe fatigue. There's another video on this in this list from the first selectman, Rudy Marconi, who really goes through his symptoms in detail, and he had an average case. He was really, affected for about 3 weeks and was at home feeling ill for that length of time. So even a quote unquote mild case of COVID-19 was made people as sick as they had ever been. Our statistics in our practice were what we had been reading in the medical literature. About 80% of people who got COVID-19 were able to stay home. About 20% ended up needing to go to the hospital and being evaluated. Many of them were admitted. Most of them came home, and some did not come home, especially as you can imagine, older people and people who had significant comorbid conditions. We did then the video conferencing for about 8 weeks, and decided that as the numbers were getting better, this is now in May, we decided it was time to start seeing patients again. We decided to time that opening to the governor's phase 1 reopening in the state, which was May 20th. And we began giving people an option of seeing them by video conference or having them come into the office. And we were a bit surprised that most patients decided they really did want to be examined and to come in. So that started about over 2 months ago. How did Ridgefielders respond? I think very well in general. People were careful. If you were an older person, a lot of those people just did what they were asked to do. They really stayed home. They did not go out. They might have food delivered. They might have a friend go and buy food for them. People were generally very compliant. When they did go out, they wore masks, and they were respectful of each other. Because of the way this worked, masks have been shown to be very helpful. And if I wear a mask, I protect you. If you wear a mask, you protect me. So it has to be kind of a community project to do that. And I found Ridgefielders very respectful of that. And with that, our numbers have gone down significantly. Ridgefield, interestingly, set up a system in which people who wanted to have a nasal swab done could do that, and at one of 3 Saturday morning drive-throughs. And those were done about 6 weeks ago. 700 people participated. 6 of them were positive for COVID-19. So meaning that the rate of in Ridgefield at that time had dropped down to about 1 person in 100. And currently, over the last month, probably Connecticut is ranked number 3 out of 50 states in terms of having the lowest number of new cases per population. I'm also the medical advisor for the school system, and hopefully someone else will give a longer description of how the school system functioned during this time. But I'm part of the reopening committee as we're getting ready to look at September. And I just did want to just mention that I've been enormously pleased by how well organized this effort is. The organizers, who are administrators in the school system, set up 7 committees and staff those subcommittees. I've been on the health and safety committee. Lots of meetings, lots of literature to read, and we got through a very, very large amount of information in a relatively short period of time, so that we could submit our report to the state last week. And now, between now and school starting, we have lots of work to do working on some of those details. You can imagine it's just an enormous amount of details and a lot of work, but it's been well organized. Division of labor has been great. So just a little bit of information about one person's view of the COVID-19 pandemic. Hopefully we'll not see one again in any of our lifetimes. Thank you.